Good morning, everybody.
Good morning.
Come on, wake up, man. That's good. So finally, we are coming to the hot topic, which is like the sitting in Sundarban and discussing climate change and its impact on our health. That's a hot topic, right? So I have very interesting and very distinguished panel members, who would be sharing their experiences and who would be, uh, sharing their recommendations as well as to how to shape up, how to design, and how to sort of plan the intervention in Sundarban area to address the climate change on health and taking into account the various other aspects that we have been talking about, like gender, we discussed yesterday. We also going to discuss the digital health, which forms a very important component of this whole strategy. And all throughout, I think we will be talking about data, metrics, and tomorrow I think we'll be discussing on the KPIs. So all these become very integral part of developing a strategy framework that we can sort of pursue as a team over a certain defined period, maybe 1 year, and then on those measurable sort of indicators we can see like whether we're making any progress and what are the learnings we are having so that we can incorporate those for the year 2 and year 3 and so on and so forth. So I just wanted to set the ball rolling by um, by sharing a few lessons or few things that I've picked up from various sources. As I said yesterday during my introduction, I'm a learner. I really don't know. I don't think anybody really knows how the climate change can be mitigated. When it actually comes to whether it's livelihood, whether it's health, and so on and so forth. I mean, we have ideas. We are reading a lot of material, we're listening to various things, but like we still haven't really come to terms with like what works, what may not work. So this session, I would be really focusing on not just hearing what's being done, but also what is being done all over the globe and what are the lessons that we can sort of bring in here. We will also try to sort of get some 2, 3 action points out of this discussion. To start with, this is very interesting. To start with graphics, I came up. I think ABT follows this whole climate sort of the framework to identify and prioritize health areas from time to time in different parts of the world. So it's a very interesting looking graphic. Has a lot of things. Many of the things I can't relate to, but it's in a global context it makes a tremendous sense. So if you see the center of it is basically looking at the various kinds of climatic change and the impact that we usually have. So it starts with rising temperatures, more extreme weather, rising sea levels, increasing the carbon dioxide levels, and then how it impacts like the in terms of the extreme heat, severe weather, air pollution, and so on and so forth. And then how does it sort of get sort of amplify into different health areas. So and as you see, it's a circle and it's a wheel which sort of keeps moving, and so this is nothing fixed. So we cannot say in Sundarban we will sort of prioritize the following health areas and we'll stick to it for the next 5 years, because the things obviously are very dynamic and things will change over a period of time and we have to adopt. And these are probably it's some kind of a guideline, I would say, to help us sort of from time to time identify what is the real effect of the climate change, and based on that, what are the potential health areas that we need to sort of focus on. So it is just a guide. I mean, I thought it's worth sort of sharing with all of you. Uh, the other things that which have been published in various media and various sort of articles, about 4, 5 very high level, very broad sort of the things that we can do more from the supply side, less from the demand side. One is reduce the direct power consumption and use the renewables and energy efficiency or efficient devices, so that there is a less harm that one can sort of achieve. The second is reduce the indirect emissions, through sustainable use of materials and circular economy, particularly whenever we are sort of delivering health services. Supply chain contributes a huge amount of impact on the climate change, and so therefore, how do we understand how they are sort of contributing to the climate change negatively, of course, and then how do we mitigate that, and taking that into our scheme of things would be really helpful. Uh, Radically optimize care along its pathways. I mean, that's a very critical thing. That there are thousands of things which are done, but do we need to do all of them? Can we optimize? Can we sort of naturalize? And these are the kind of things that a number of times mentioned in many of these articles, which are not necessarily saying that this should be done. They're saying like, these are the possible ways. So what we need to sort of keep in mind is, can we look into this? Can we see what's relevant in our context and sort of act on it? And lastly, like, step up, run faster, man, run faster. I mean, not much of time is left. I mean, we have our life, but there's a lot of other lives which are sort of at stake, and so therefore we need to move faster. Coming to today's discussion and taking the climate change on health, I think what we are talking about broadly, we need to build a more resilient sort of a market systems. But the reason why I'm not using the term health system, because that's a very cliche kind of a thing, and we all sort of contribute to the health systems. But the reason why I'm saying again the market systems is because in an isolated or targeted areas which are slightly off the mainland or the mainframe sort of problems, often what one has seen that unless you work at the systems level uh, with the funding or with your sort of interventions coming to an end, the whole thing sort of falls flat. And so therefore it is very critical that we sort of try to look at how can we build that market that can sustain itself over a period of time, and given the high risks of the emergencies or the very specific situations it undergoes. So there has to be a resilience and a response strategy that needs to be built into the system so that the market can withstand those kind of threats and pressures. Uh, just to structure our discussion a little, in a way, keeping the health system components in mind, and so that when we get into the KPI, or if we have time, we can draft some kind of a theory of change. That this is the current situation, and these are the problems that we face in our context. And so these are the kind of interventions that we are thinking of, and this is the anticipated output and the outcome. That kind of a structure, if we can build, and against each level we can sort of see like, what are we reducing in terms of problems or the barriers, what are we improving in terms of the outputs and the outcomes, and that can lead to a sort of a more measurable, a more objective way to achieve our objectives. So there are broadly these factors, as we all know, in the health this thing. At the very core of it, what works is the micro market factor, which is there is a demand and there is a supply side. Okay, so there are players, there are private sector, there is public sector, there is government per se. Okay, and so what we need to understand is that who constitute the demand side, who constitute the supply side, who are there, what are they doing, what are they not doing, and what is the need as far as the community is concerned. And one of the things that we keep talking about is climate change. How many people actually see themselves at risk? The very self, yes, you do, and probably you're doing something because of that, right, Kevin? I mean, I'm so happy to see your finger up, and you are actually believing in that. Therefore, you're doing something. But think about many of us sitting here. How many of us are actually seeing ourselves at risk? And then take it to the community level. They have thousands of things to do, man. Are they really thinking that they are at risk because of the climate change? No, I'm hungry. My kid. Critical that we look at the behavior change because it is not a ready market and people are not ready to accept your messages. So how do we create that the ambience so that all the support factors there so people start sort of seeing themselves at risk and they get to know what to do, what is the impact of doing XYZ, and so that they take this first step, they have an experience which is satisfying, then only they will go into the next one. And that's how the behavior change happens, as we know. And all along, the supply plays a very critical role. So I'm saying that this is what we are living with, and we will be particularly iCure when you're implementing activities. This is where you are operating. But don't forget, there is a larger world around you, and that's very critical. So what are those? First of all, rules. There are some rules within which we will have to operate. By rules, I mean the policies, regulations, and there are some informal norms in the society. I cannot just say just go and sit in the sun. Everything will be okay. It doesn't work. The society, the community, the individuals, they have certain normative beliefs and attitudes in their minds which have set for a very long period of time. We have to respect those. So you have the government rules, you have the community rules, and if we understand those rules, we can understand what are the favorable aspects that we can use in our program, and what are the unfavorable things that we can probably influence to change, but there could be many others. There's nothing we can do about. We have to just give up those, give up in the sense that somebody else has to work on it and actually influencing those somebody else to make that happen. The other thing is the financing. It's good to say that I will do X, Y, Z, but do we have the incentives, which is the financial incentives, the insurance that Pompey has been talking about, micro financing and all that stuff? Do we have those resources available? Do we have the strategy to pool resources? Because my own health resource may not be adequate. But this is not just health. If people have to live in a proper way, it encompasses and takes into account various other parts of one's life. And so therefore, can we bring in the wildlife fund? Can we bring in the other livelihood funds? Can we bring in the education? Can we bring in the agriculture? Let's look at a multi-sectoral kind of an approach to get the resources in place so that that individual who is sitting at the center, their lifestyle, quality of life can be improved. Let's not just look at it from the health lens. Health is an indirect impact of everything else. The first thing that happens when we were feeling hot yesterday, when we came into this place, we were looking for the tables which are under the fan or closer to the fan, right? We didn't think about the health. Health came much later, and I am not really feeling good. Let me go to the room and take some rest and come back. Kevin decided not to have dinner and went to sleep. What a wonderful decision you took finally, because you really finally it hit your health. Okay? But before that, you said, okay, let me have one more cup of coffee. Okay? Let's go on. And otherwise, what will Todd say? All those considerations do come to our mind first before we actually come to the health. So I think that relationship has to be kept in mind. The other thing is support. We cannot do anything by ourselves. So what are the support systems required, and what are the support systems which are available in Sundarban becomes a very critical factor. Now, there are a lot of sub-factors, including stewardship, governance, things like data availability and all that stuff. And there are some cross-cut in Bali. Just imagine the amount of time, amount of opportunity cost, amount of travel expense, etc. they have to make. They have to also take care of their children. They also have to take care of their agricultural lands. So the opportunity cost is enormous. So therefore, what becomes important is that it is how do we bring in that technology? And somebody, I think yesterday, was talking about that, cell phones are great. But how do we make the use of cell phone relevant, appropriate, and useful to each community's sort of benefit is very critical. The last thing is what gets measured,
gets done. Because what gets measured gets you money, right? Whether it's a baseline or whether it's an end line or a midline. When the graph is upward, money keeps pouring in. And it's not just the money, it is also for us to understand that we are doing the right things or not, and whether it is being acknowledged and being sort of accepted by our community. So this becomes a very broad framework within which the climate change impact can be measured. So what's the climate change impact on the gender integration? What's it on the digital health? What's it on the data matrix? What's it on the rules? What's it on the support, financing, demand, supply? If we can look at it from all these factors, sub-factors, the climate change, then we probably would be coming to a common sort of a pool of aspects that we can prioritize from and then develop our plan. Does that make sense? It has to make sense because that will finally help us to build that end goal, which is that sustained, equitable use of priority health areas. Because if we can have this, then if things are falling in place, people will probably sort of be able to behave in this manner. And that's a behavior change objective that we can set for ourselves. I'll stop here, and I have my panel members, and I would like to sort of invite one by one. I mean, Joy Satra, please come. Do you know him?
Kind of getting to know.
Yeah, we are getting to know him. I mean, of course, we are here because of him.
What lies beneath.
My next speaker is, or panel member is Pompey Sridhar. Once again, I mean, we have been hearing her, we are listening to her, and we have been seeing and learning a lot of things that, Pompey and her organization has been doing world over. We have my third panel member, Todd. Todd Huber is, again, he's one guy who has been sort of in the community and sharing for the last 1.5 days, all the good things that they are picking up, which can really inform us to develop the strategy and the KPIs. In addition to our panel members who are sitting on the dais, I will also be pulling in a few other experts from time to time to share their sort of inputs on this particular topic. So, okay, so Shuja, let me start with you because we are here because of you. So my first question, we have been hearing about climate change, we have been reading about climate change. So if you can sort of briefly describe the situation that you have been observing in Sundarban in terms of how the climate change is really impacting here. Now that leads to certain opportunities for you to sort of exploit or to design your program and deliver the goods and services that are highly prioritized. And the second thing is there could be, on the way, you have seen some challenges and you anticipate a few more challenges which you would be sort of facing. And so if you can give us that, how you're going about, understanding the Sundarban context and designing your program and what are the kind of things that you're doing, and your experience in terms of opportunities that you see and challenges, that could be a good starting point for us, and then we can move on from there. Yeah? Over to you.
Okay, yeah, thank you. A very good morning to all of you. So I would say that when we started understanding Sundarbans, because we would still say that we know very little about Sundarbans in the last 1 year, or a little more than that. And when we started exploring the opportunities and the difficulties in this particular geography, which is home to more than 4.5 million people with only around 47 primary healthcare facilities, which roughly is for every 90,000 odd population, we just have one THC. And in many cases, the doctors are not available. So some of the geographies, for example, in Kumirmari Island, that particular island has lost close to 30% of the land mass in the last 30 years. And this particular Sundarbans has seen more than 4 cyclones in just less than 2 years. Every such cyclone is bringing in, saline water into the mainland, into the ponds, and that is also making the whole farmland infertile for at least next 2 to 3 years. So, if you look at just particularly about Sundarbans, especially with regards to the problems related to the skin ailments, which we are already seeing. We are seeing vector-borne diseases like dengue, which is definitely on the rise. And what our objective and thought process is that since iCure is positioned as the population health screening provider, what we could understand and using our, I'll talk in later detail, is how we would be able to use different tools, technologies, artificial intelligence, predictive algorithms to predict that over the period of time, what kind of factors or disease patterns are moving, and whether that has any linkage with that with the climate change or not. So I'll put that context setting for you to drive from here.
Thank you. I mean, can you little bit of this? What are the specific activities that you have been focusing so far? Before I come to Pompey, just one probing question.
Specific set of activities, like we have set up our own clinic in Komiramari, and we have our own, and we are setting up in Sajilia Island. We have deployed the frontline community health workers, so they have the backpacks with medical equipments, and they have the smartphone loaded with their application. So for the terrain of Komiramari, which has close to more than 20,000 population with 0 doctors, now our health workers are able to go to the patient's doorstep, capture all the data, enter the data into the platform, and then initiate telemedicine between the patient and the doctor, which we call them as aided telemedicine. So unlike a pure telemedicine, we are able to do way more, wherein the patient is able to speak to the doctors with the support of the health workers. Plus, in many cases, the doctors might have any suggestions, questions, queries, which even the health worker is able to fulfill. And in many cases, even especially for the pregnant mothers who are not able to come out to go to the main healthcare facilities, I think these health workers act as definitely a key medium to provide healthcare right at the patient's doorstep. So these are the set of activities we are doing, and on top of that, we are trying to understand the different patterns related to health outcomes, and we are trying to linkage whether that has any implications or that with the planetary health.
Thank you. Just to quickly summarize, I mean, 3 things. I mean, he started off with a few problems and challenges, lack of access. I mean, the density of availability of doctors is a big problem here. He talked about lack of availability of information, knowledge about Sundarban per se. He talked about high incidence of natural calamity in Sundarban, and so in this context, the things that we have heard so far, one is like to improve the access. He has been sort of introducing the services, including the telemedicine in a form that is more appropriate for Sundarban. What is interesting is to iCure has been focusing more on implementation component rather than high level strategy at this point of time, but it is more of doing is learning. So you start putting in a few inputs, automatically you learn better rather than sort of learn first by theoretical way and then sort of go into the field. Interesting. And so I think over a period of time, or at least in the next 1 year, we will have some information to improve our learning and plan better. Moving to Pompey. Pompey, you come with tremendous global sort of a repertoire of information, knowledge, experience, lessons. And obviously, I know that MSD is known for a lot of the maternity or maternal health related stuff, but your experience sort of cuts across many fields, both health area wise as well as your financing stuff is tremendous. That can play a very important role in this context. So my first question to you is that tell us something about what are the things that you have picked up from the global that's happening to mitigate the climate change, keeping the overall health, and what kind of financial strategies you have seen being deployed and or ideally working successfully. If you can share some examples, some learnings from there. Over to you. Thank you.
Yeah, thank you, Soumitra, for the question. And firstly, Sujay, I can't thank you enough to organize this conference in such a manner which is really grounds up, where I, for the first time, had really seen looking at challenges very different from what I had heard of or could have imagined, that folks face on the ground. If you really look at what the international development community is doing at this point, is really doubling down on climate to impact the work that they do, whether it's around health, energy, economic empowerment, equity, all of that. And why are we doing that? Because there is an urgent need, and we are looking at, staring literally at the environment for themselves. And using all of the global best practices really solve for those challenges. And I think ILO has kind of declared it in 2015. But I was wondering whether, and when I was walking, I was kind of trying to see if there is any board that says a program supported by ILO, which I really didn't. Right. So I'm going to go back to ILO, which has kind of reached out to me just about 2 weeks back, saying, "Come and meet with us. We want to look at all of these issues," and so ILO has this whole stated objective of climate financing and just transition, working on solutions which are grounds up, ground zero, and these should be used as blueprints. And earlier in the past, when we have worked on such health initiatives, ILO has collected some of those 4 or 5 good initiatives and kind of showcased it world over, so that not just attract funding, but also best of solutions to solve for a challenge on the ground. So I'm really hopeful that this work is just a precursor of many such community-led solutions that will come by. And financing really has a role, because what is being asked out of financing, the financial sector, is to also now include environmental outcomes, social outcomes as part of all financing that is happening. And that therefore drives a lot of, I would say, change on the ground. And so, and I've seen, in fact, my family is also into private equity. Does green investing, and they wouldn't even if they have done the investment, they would go across and really look at whether the greening is really happening. So the greening, how will it happen, and how do we hold everyone accountable, will be from these communities. The communities are going to hold people accountable to greening, and that is, I think, something that we can learn from Sundarbans and take it up out there. On the other hand, there are also financial sector solutions which talk about agriculture insurance, catastrophe insurance, and every time there's a cyclone, there's hordes of discussion that happen in Delhi. I wonder how many have actually come and insured, either the fish out here or agriculture and all of those things. I've been in several of these meetings in Delhi and otherwise at ILO as well. So I think I'm going to again take that message back, and thanks to some of the stories that you have put. I mean, we have been talking about these stories, and we were trying to collect these stories and showcase the ground reality elsewhere. So I think the work that you're doing, to me, everything is kind of come in one place. And hats off to you, Sujay. I mean, you've been kind of listening to folks internationally, and you've been traveling, and you're really doing things on the ground. Again, a very rare example. And, I can't thank Anil enough. I've been having, chatting with him since morning, and I just heard so much of insights from him that I think are so relevant to shaping some of these policies itself. So lots of work to do, and I'm sure that I'll be visiting Sundarbans soon with some other different set of stakeholders to actually showcase exactly what's happening and to help build some of these things there. But look up the ILO's Climate Finance and Just Transition. It has exactly these stepwise and gives you a very nice framework. But I'm surprised that ILO's not coming.
Thank you, Pompi. That's really that's very, very focused. Two things she has just brought out. One is put the community at the center, and we have to keep the community throughout the this sustenance period that we're talking about. This community has to be. If we can institutionalize that, a lot of the problems or the solutions that we are talking about or we can't see today will start emerging. That's number one. Number two is that what she's talking about is that a sort of a multifaceted kind of a approach which brings in different sectors, agriculture, economy, everybody comes in. It's not just the health. And it is in that context what she's referring is like the ILO framework and the strategy that we can refer to, and we can take a few pages and lessons from there. The financing part, is very interesting. You see it in the context of the multifaceted, and the community context, and obviously the solutions would be very different and not just what the ICICI or somebody else is talking about. I also would like to add, something that you mentioned yesterday, the Orissa example, which really, really resonated with me because, yes, Orissa was at a point of time we only remembered come summer and then the monsoon arriving and Orissa goes kaput. That is what Orissa we remember as. Or for example, why is it that in the Andaman and Nicobar Islands, we don't hear other than the typical tsunamis and things like that? There's something right or something good which is happening in these areas within India that we must take lessons from. Sorry, and go to my third friend, Todd. Todd, we have been hearing a lot about the community component that you just mentioned. And I would like you to sort of share in a little more detail and keeping the overall framework that I was just talking about some time back, going to follow that and it's those components, that what are the thoughts that you have really which can help us to empower the indigenous community, for this to happen. That we always talk, we used to say that, put the community at the center, but then how do you do that? What makes it happen? And what do we need to do to make that happen? Is something if you can touch upon, of course, with specific focus on women, because as we heard, large number of men, they sort of, out migrate, from Sundarban for work purpose. And so it's the women and the children who are holding the fort. And so how do we sort of bring them in and make them the real change agent is something we would like you to sort of touch on. Over to you.
I appreciate that. I'd say I'll start with putting the community at the center. And one way to do that is recognizing that they are at the center. All things are local. They're not at our center, but they are at theirs. And if you genuinely are passionate about the impact or having a positive outcome, recognizing that they're the ones that are going to ultimately decide whether it's successful or not in their community. And if you don't put them at the center or recognize that success is going to happen by having that be the case, we can approach from the outside and bring a solution in to a problem that we don't understand and cause a great deal of harm. And there's thousands of examples that help explain that, and we've learned that over time. But it's not to challenge the passion of those who are seeking to implement that change or the nobility of their intent, but it often comes from a place of pity and seeing individuals as victims and feeling in some way compelled, wherever that comes from, to want to then help them. But that place of pity kind of has embedded in it this bias that they're incapable of helping themselves, or that somehow they're different than you, or they're different than us. And their DNA is the same, except they're in like hardcore training environments. They're like athletes that are encountering these incredible challenges in ways we can't out with. I wanna make this change. We've already have an issue of I want to do this thing, and it's about me. I'm actually at the center of that change. And a great deal of social impact has the social impact individuals at the center of that change. It's not coming from a place of I'm really curious about this culture and I see the beauty in it. And when I see that beauty, I now want to engage in some way of reverence, out of respect. So when we approach these communities out of a place of respect, it is so much more fulfilling. So it becomes addictive. When you see something that's beauty, you're just drawn into it. You want to be a part of it. You want to replicate it. You want to see it again. You want to touch it. And beauty scales. So when you're called to that place where I really connected to that community and want to act in that way, it's also coming from a place, if you've gotten to that point of having that level of respect and understanding the community, then the actions you take are so much more informed. There's so much more partnership because you're doing it for that interaction and to get into a deeper level of connection. So fundamentally, we're going to have the opportunities to make major change at resilience to climate change in communities by approaching them not from a looking down perspective, but a looking up. We talked about that a little bit yesterday in recognizing how strong and how educated, how informed the community is compared to us. And when we do that, then looking at, they're letting us this gift of coming in and spending time with them anyway. So that's kind of a first piece. The second piece is, the graphic up there on climate change and health. I'll bring it to that topic. Social determinants of health has become a kind of a buzzword. It's very powerful. And if it's not something that you're familiar with, I can encourage anyone interested in health should spend as much time as you can to get a deep understanding based on the fundamental, conclusive truth, non-debatable, that somewhere between 80 and 90% of health outcomes are not driven by healthcare. And most of us think about healthcare as being the solution to health problems. But if you have 1,000 people with cancer, the outcomes of those people, 80 to 90% of those outcomes are going to have nothing to do with the doctor or the healthcare that they receive. It's what their education level is. It's what their income level is. It's the way that they're living their life. It's whether they have a support network. Do they have friends in a community? It's how policies are put in place and how people execute those policies. That is the vast majority of health outcomes are driven by those factors. So when we look at climate change, the impact of climate change on health, it's going to the kind of the dust on the top of the mountain are the direct impacts of climate change. The respiratory illnesses, these things, and those are huge. There's massive, but that should scare us when recognizing that there's a whole rest of the mountain below that is about people here in the islands. The health impact of them not being able to farm is way more than the climate change impact on access to health. But because of that, they're going to need even better access to healthcare. Right, so I'll say, then the last point was on women, and so I'm a proud girl dad. So I have 4 children, 3 of them are girls. I have a very strong, smart, brilliant wife I married up. And I'll say, if I've learned anything, there's a different perspective that gender offers and your life experience of everyone offers is different. And for anyone interested in change, it is conclusive. Climate change is happening, and it will happen, and we're seeing impacts of that here in the Sundarbans. But the response in the near term, at least for the communities, is about how they adapt to that climate change, how they adapt their way of life for a culture that traces itself back in folklore over 2,000 years. This is a deep, rich, amazing culture, but their adaptation is going to be required, which means change. And all the academia on innovation and change makes compelling arguments that the more diverse sources of ideas, the better ideas. If you go fly into South Africa in the airport, there's a big sign, whether it's still there or not, I don't know. but it's an old proverb in Africa. We heard it on the streets in Ghana, in some of the communities in South Africa. If you want to go fast, go alone. If you want to go far, go together. And the struggle, I think, as outsiders, frankly, that we bring is in kind of a modern, fully developed world, the Western world, we get gratification so quickly that we put such an incredible priority on the pace, and we've got to get solutions on the ground implemented immediately. I think we do need to learn as fast as we possibly can, and Sujay has done an amazing job at doing that, like get on the ground and start running. But we also need to take a deep breath and have a pace that allows us to include as many voices around the table as possible. I was had the opportunity to spend time with Madeleine Albright in this event, and she had a former Secretary of State of the United States, amazing woman, amazing pioneer for women, and she made just an incredibly compelling argument around, for those of you who think everything should be run by women, you don't remember what it was like in high school. This is her comment. And she was an advocate for diversity in its truest sense. That if it's all women, that's also a challenge. And if it's all men, that's a challenge. So where do I think empowerment on finding solutions in climate change as it impacts the community in Kumimuri, or in general with any community, it's about ensuring that around the table is the most diverse group of people that you can possibly assemble when you're seeking solutions. I do think, and you heard me say this yesterday, that everyone on the table who's not from that community should be in listening mode when you're talking about the problem, and just invest a great deal of time and effort trying to understand the problem. When it comes to solution, though, then again, as many people as you can. And in the Sundarbans, she said it's around somewhere 50 to 70% of working age men are gone working. So those who are going to be implementing the solutions on the ground here are likely going to be women. So it's even more important that they have a seat at the table. If that answers your question.
Of course. Thank you. Lots of points, lots of takeaways. There would be questions to all of you, what they have been talking about, what are the takeaways. So please note down, okay? Couple of very interesting ones, like, the self-efficacy, the self-confidence, building that confidence in the community or whoever we are working, of trying to put them in the center is very critical. Because not necessarily they have that efficacy perception about themselves. We have seen it in various health areas. They know it, they know where to get it, what to do, but they haven't done it. Why? I really don't know whether I can do it or not, whether it is within my control or not. That's a very critical thing. So it is not just putting them at the center. It is definitely very important first step, but also sort of empowering to the extent that they can do it. So make them do it. Other thing is the social determinants thing, is very interesting. I mean, there's a very famous case study from India, Rajasthan, an old days like family planning example. 2 villages, exactly the same modern CPR or even total CPR. Okay, the supply side is common. Demand is one is, after the intervention has gone up, the other one hasn't gone up. Okay. And then comes the intervention 2, and the one which was lower had also gone up, and gone up even beyond the first village, which had shown more improvement. So what happened? So 2 villages, there was a healthcare intervention, family planning, education, the usual stuff. That supply side methods were available, the choices were available, they were made sort of informed about it. The second intervention, what it did was it electrified the village. The moment the electrification happened, the economic activities went up. People were not going to sleep by going to jumping into the bed by 6 o'clock in the evening when the darkness prevails. So point is, it was nothing to do with the health intervention or the family planning intervention. It is something else which made that huge change. And following that, the Minister of Health and Family, because that sort of accelerated, the word you have used, accelerated whatever we wanted to sort of achieve. So it's very critical to sort of keep that in mind. There are many other examples, but for time's sake, I will have to sort of, but do take note of this. And what we are discussing here is, again, as Todd puts it, it's the tip of the iceberg. And there's a huge chunk which is waiting down there, which we need to sort of unearth and understand and gain insight. To move forward, I want to bring in some perspectives. One is, we have heard challenges, we have heard different kind of things that we can do. We would now like to understand, what has been done right, and what do we know from the research or available data, or even research from Sundarban, that we can sort of incorporate into our thinking and strategy building. So first of all, I would like to bring in my friend from French Embassy, Emerich. If you can share, some examples of what did you guys do in France that we are not doing. I mean, of course, we don't get the French wine. We don't get the French wine. I mean, you're drinking that. I mean, we know that. But what other things that you're doing which makes it, so easy for you to achieve these results?
Yes, thank you so much for the question. Well, as you all know, France is not just a country in Europe. It's actually a country that has territories all over the world. More than 2 million actually of people live outside of Europe. So we have territories in Pacific, but also in South America. So I say these two territories because in South America we have French Guiana, and there it has, and I mentioned that earlier, but it has very similar issues as in the Sundarbans, because you have communities there that have been isolated for a long time, and climate change is actually making them even more isolated. And the access to health and to healthcare is really hard for them as well. So I've been talking to a few doctors there, and I was asking what really works there. What is the kind of thing that you as doctors make work there? Because it's the same issue. There's no doctor, and so of course they sometimes take helicopters for very important disease and so on. But otherwise, they have found a few things. So first, what is at heart, and we mentioned that earlier, is the ownership of the communities there. So one example is that you have primary healthcare, but if the issue is slightly more important and you need to transfer to hospitals in cities, usually the patient choice and decision is what matters the most, more than its own health, because they told me that if you force them to do this, then they don't trust you, and then for the next times it will be even harder to bring healthcare to isolated populations. The second thing is telemedicine. So we mentioned that also, but they have also lots of skin conditions there because of tropical diseases, but also respiratory diseases, but they have mostly skin issues. And this can be actually really diagnosed through telemedicine. So French hospitals there in Cayenne, but also what we call peripheral health centers, have been put in place to actually try to bring the data and give also a consultation for doctors to this population. And usually in 80% of the case, it was a single diagnosis. So it means that most of the cases usually have been resolved quite easily. Obviously, there will still other cases that will be harder to deal with, but it is a solution that works maybe not for every kind of health issues, but for skincare conditions, what is also very important in Sundarbans. This worked in French Guiana. So French territories tend to be very affected by climate change. In French Polynesia as well, so in the Pacific, you have the rise of the seas that is also very prevalent. And so the authorities are always trying to find solutions, but it's hard. So one of the things that we are trying to work on right now, so the French government launched 2 years ago, this is called the PRESAD initiative. So it's basically trying to reduce on the global scale the risk of emergence of zoonotic diseases, which is obviously very linked to also climate change because animals and humans tend to be closer together. and we're trying right now to put the Indian government on board. So far, we have 8 research institutes from India. And so we're trying to get the Indian government on board, and we're sure we're going to manage to bring it on this initiative. Yeah.
Thank you. Thank you. Can we come back to the questions a little later? I'm sorry. I mean, yeah. So, 4-5 keywords: ownership of the community. Second, the choice of the patient. Third, the relevant diseases. That's very critical. So let's not go and put our national agenda of family planning and maternity care. Let's look at what they are facing and what they are interested in, what is bothering them, and let's start the dialogue from there. Naturally, the buy-in and the ownership comes, and that is the way to start. And then you can, obviously, the health is a much wider area, so they will be open to many other things, and technology, the use of technology. That's the other thing, and how we can adopt that technology into our business. Thank you very much. And the other learning from his talk is that yes, French wine is better than Sula, but there is something good in Sula that they are now started sort of putting into the French wine. Thank you. Okay, I'll move briefly to another friend of ours, Sangeeta, who has done a lot of work in Sundarban. And the vast geography which is around Sundarban. What are the key inputs that you would like to share in this context? I mean, obviously keeping in mind the climate change as a major sort of input here. So what are the factors that you would like to sort of share? Thank you.
I think one of the very key issue which affects both the demand and the supply side is accessibility. Because of that, a patient cannot approach a health facility. Because of that, you cannot get a good doctor, nurse. So, and this accessibility, it cannot be solved because geographically we cannot say, I will build some highway or this thing. So with this context, and sometimes, making it very modern and all this thing, if you are trying to build up road and all, it will have a negative impact on this island. It's a fragile setting. You have to understand it is just on the land, but there are so many species out there. You will be really playing with those species, like human and animal, they are staying together. So with this accessibility, if ICURA is working on this thing, so you have to take care of that and build your innovation and intervention. How with this context will be there, but how you can bring there actually the digital health will come where both the challenges from the demand and supply side can be met together, and how more innovation you can do looking at the socio-cultural context of the community. Not too much of literacy are there. They have their own way of traditional medicine. Those things are also there. So you have to look at the social cultural fabric of the community, the accessibility issue, and where I think the digital health really will, I think one of the key aid. You cannot get doctors. There is not much doctor in proper mainland only. So it is something, it will take some years to get it. Yeah, thank you.
Thank you. I mean, it's a very important point that development hampers natural habitation. We know that. And so while we can push the agenda of development, but we have to keep in mind, just to achieve the accessibility, we should not create that imbalance in the ecosystem that ultimately can boomerang, because that can have adverse effect on our health and various other things like livelihood and things like that. I mean, yesterday when we moved from the water to the land, we realized that, oh my God, this is not a great trip. Why? This is not a great trip because the back was boom, 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 boom. But I realized in 10 years time, it used to be a kacha road, Pagdandi, so we used to sort of walk on that. I mean, last time when I came, I didn't see these concrete roads that time. But that's development. But that development created a massive back pain for me.
And women in labor going in this road to a facility, just imagine.
Yeah, absolutely.
Yeah.
Uh, so in that context, so accessibility has to be sort of intertwined with the, relevant accessibility in a way that it doesn't change the ecosystem. And in that context, what she's talking about, the technology, use the technology in a manner that it can sort of help us achieve that objective without disturbing the ecosystem. Thank you. We are coming towards the end of our session, and we have a gentleman who has, who couldn't be with us here, but he has been able to sort of share his, his thoughts and his thinking with us through a recorded bite, and we would be sort of playing. So his name is Dr. Rajadhar. He's from C.K. Birla Hospital in Delhi, right? Sorry, Kolkata. And he's the head of the department, pulmonology department, and he's going to sort of share with us his experience, particularly with reference to the COVID-19 pandemic. And so it's a very important, sort of a bite, because he shares information which has tremendous, relevance to the kind of, adversities that we see, which emerge particularly after, the pandemic. And as Kevin was talking about this morning, that, who the hell cared about mental health earlier? Did we ever talk about mental health? It was all there, but I think we started noticing it, talking about it, and sharing it and coming out in the open only after the pandemic. So pandemic has opened up a lot of things, and here is one other example.
My name is Dr. Rajadhar,
Volume.
and I head the Department of Pulmonology at CMRI Hospital in Kolkata. It's a great pleasure for me to come and speak to you at Unconference in Sundarbans, even though unfortunately I am doing it virtually. I would have loved to do it in person, but it is the nature of my job which prevents me from being there with all of you in picturesque Sundarbans. I have been asked to be a part of this panel discussion by Mr. Sujoy Shatra and Mr. Debashish Bhattacharya, and I'm honored that I am being a part of it. There's a couple of questions that I want to address in the next few minutes, which would form a part of this panel discussion. I'm not an expert on planetary health, and hence what I'm going to speak about is my understanding of planetary health and its repercussions on human health. We have just come out of the ravages of the COVID pandemic, a pandemic which is aerosol borne and hence affects the lung. The impact of planetary health and some of what I'm going to speak about also changes the aerosols that we breathe, the ambient outside air that we breathe, and hence also results in chronic lung conditions. Hence, there remains a thread of commonality between what I do on a day-to-day basis and what we hope to achieve with Unconference in Sundarbans and many other global programs which aim to improve planetary health. If you think about human health and the health of our planet, these two are intrinsically linked, and our civilization depends on natural system, stewardship of natural resources, and then only human health can flourish. There are multiple examples of what entails planetary health. The case of polluted water, soil, and air all come within the umbrella of planetary health. One of the articles that I read a while ago talks about 2012 and World Health Organization figures which estimate that the exposure to these polluted mediums contribute to about 9 million deaths worldwide. And imagine 8.4 million of these occurred in the low and middle income countries, which would include our country, India, and places like Sundarban within it. Global heating is another form of planetary health which needs to be addressed. Heating leads to more frequent and extreme weather events such as heat waves, wildfires, floods, and storms. And these endanger lives, harm mental health, spread disease, and wreaks havoc to people's livelihood and hence to the wider economy. Climate change affects the social and environmental detriments of health. And for me, as a pulmonologist, climate change is something that I can relate to. Clean air, safe drinking water, sufficient food, secure shelter are basic human needs. And you would think that in a civilized world, in the 21st century, you would take these things for granted. However, a vast majority of the civilized world, the developing world, does not have these as a matter of guarantee, and that's what makes planetary health so very important. Between 2030 and 2050, climate change is expected to cause approximately 250,000, you heard me right, 250,000 additional deaths per year from diseases like malnutrition, malaria, diarrhea, and the heat stroke, the heat stress that we talked about. These have economic implications, and the experts within you out there at the meeting who will talk about this in much greater detail and with greater understanding. However, I understand that these amount to billions of dollars per year by 2030.
Government protection, the government support, the government sort of policies, they play a very critical role. You cannot achieve unless government also owns. And so, what Todd had said that, it's important to put them first. If you don't put them at the center, the process doesn't begin. Yes, true. But not just put them in iCure program, put them in the context of Sundarban, and therefore the government, what are those committees, what are those bodies where the community has, the representation has to be there. Otherwise, things will not move. Nobody will be heard. It is like iCure saying versus iCure has an interest. Therefore, MSD has an interest. But it's the community has an interest is what needs to be established there. Second thing is a very critical message that prevention is cure. So it's the prevention. Start very early. Start very early. Don't wait for the treatment stage to come. So if we can sort of take the behavior change route, which Sujoy keeps talking about, I think that's a very important thing, that sensitization is not just about the behavior change, is not just about the end users, the beneficiaries. It's a behavior change of the intermediaries and the policymakers as well. So they need to be knowledgeable, they need to see the risks, feel it, and how it can impact their sort of sustainability. The politicians have to understand that if they don't do it, there is no vote bank left, right? So I think we need to relate it to their sort of areas of interest, and that is the way forward. Coming back to our esteemed panelists, so my last questions to all of you is that we have heard enough, we have great sort of suggestions, recommendations, and lessons we have learned. I think one of the things that we need to sort of zero in on is, if you were to prioritize 2 things, 3 things maybe, what would you recommend iCure to focus on in the next 1 year? So it's a SMART goal basically, okay? 1 year. Let's not think about 2 years. 1 year, if I were to do something, if Sujoy has to do something or lead his team and the team has to do, what would you recommend? I'll come to you a little later. Let me start from the other end, okay? Todd, it's your turn.
I appreciate that. I'll say, just as we look forward, if there's a general theme, it'd be transitioning from defining good healthcare as good health as the absence of bad health, and instead seek these opportunities to thrive, like these peaking, and so from Catalyst's perspective, what we've already talked quite a bit with Sujay about, and our intent to communicate that to everyone, is to focus on these non-healthcare factors. So if iCure's really focused on getting execution on the ground and developing that model, we want to partner with them and bring in others to look at the economics, so livelihood, and our main focus of livelihood will be on interventions with farmers to try to counter the salinity in the soil. So there's treatment options. Already have a partner who's agreed to provide kind of a leading edge treatment for salinity in the soil. We're approaching other folks who have indigenous rice varieties. I talk with them. We have two farmers who have agreed to partner with us over the next growing season. The other side of it is an education piece, which is also has an economics component to it, and that's we'd like to set up a remote education and work center. So that during outside of school hours, it's an opportunity for children to come for tutoring, for them to expand or amplify the education that they're receiving in the schools. But during work hours, then there's an adult education opportunity and opportunity to then partner with employers who would be able to provide training and employment with remote work. So, one of the results of COVID is showing how viable remote work really is, and the people who typically thought they had to go move into a city to get work often, or I think around the world now, are seeing that as not the case, that they could stay home and work remotely. So we have a tentative agreement with an employer, but we're going to approach others at doing that. So the Remote Education Center, the farmer interventions, and then last I'll say it's this logistics piece. So we do have an agreement with kind of the leading company in the world for artificial intelligence and aviation, who intends to come here to the Sundarbans and bring autonomous drone delivery for logistics on a pilot program. So it's Shield AI in the US. So I think this summer we'll work to get the air routes approved and kind of fully scope that out. But I know the Living Lab is going to be talked about tomorrow, but our intent would be for that to be the center point, but to try to sort of learn and see how much impact it would have and whether there's sustainable models for bringing in autonomous drone delivery to the Sundarbans. Thanks.
Thank you. Next time, no boat, no e-rickshaw. It's straight away fly, man. Okay, get ready, Devashish.
Yeah, I think, I've just started to think about the enormous possibilities and what I've kind of heard, world over from the donor community. But if you really think, folks who are going to be most impacted by climate change are the ones who are least contributing to it. And I think it's therefore our responsibility to ensure that everything is done in a consultative manner, and you start to adopt greener approaches more intentionally. And that's where I think some of the technologies and some of the, the work that's happening globally should be brought to bear and kind of, feedback. So this whole globalization, what is it that is, is accepted, what's adopted, what's not, it requires to be shared. So that whole learning and knowledge dissemination is extremely important. At the end of the day, when we talk about SDGs, it's about sustainable development goals, it's about blueprints that work. So I think sharing what's working, what's not, including the community, is something that requires to be done, not just for ICURE to evolve, but also for such blueprints to be replicated and scaled across various countries. But particularly, I would like you to focus also on women and children in particular, because they are most impacted. They do not move out of their houses, and they are most impacted. As much as I too agree that, I was part of a women's leadership course, and then folks were talking about women leaders as good bosses. And I was like, no, there are men who are good bosses as well. Let's not become activists. But women have a role in educating their family, looking after the family. That's their primary natural biological role. And I think we should leverage that, particularly in such settings, to ensure that they now start to talk not just about health, but also about impacts of climate change. And that is something that we can do very easily. And these communities are going to be very receptive. We need to translate the messages around the climate change and their impact, and start to engage them in talking about it. And also then talking about livelihood restoration in advance without waiting for the next cyclone, but to start to talk about livelihood restoration and to then really share those stories with the global development organizations who should come here and then feel that this is a kind of ripe place to try out any of their interventions, whether it's just transition and all of that. So I think, Sujay, great work done here. I think the blocks are all evolving very fast and just intentionally including climate. While it may sound, I'm kind of digressing, I'm not. It is one of the SMART goals that you can adopt to ensure that each of the community leaders are now talking about climate as part of their everyday conversation.
Thank you. So now I come to Sujay. So, what will you do in the next 1 year, other than flying us from Gatkali to this place?
So in fact, as iCure has been working on research, especially when we started delving into the primary healthcare, public healthcare, and as we all know that public healthcare has been like a black box. There are so many unknowns within this space. In fact, during the pandemic, some of the most developed cities, most developed countries has been battered just for the sheer lack of knowledge and understanding fully about the whole public healthcare space. So iCare has always believed that in order to really, break this huge problem, it's very, very important that how we can engage, collaborate, and partner with some of the top-notch researchers, which we have been doing, ranging from MIT, Michigan, McGill, and just 2 weeks back, our learnings from COVID was published as a showcase in the Stanford University. So what our objective is that a few years back when we were trying to figure it out, that it is indeed very, very important to bring the innovations which is happening in one part of the world to the communities at the fastest possible time. If you just look about COVID, none of the medical students who are going out has any knowledge or lack, understanding about what exactly is COVID, because these are not taught in the medical books. That will come maybe after 10 years, 15 years. So here we are already setting up a living lab. This is our own facility, which is just 1 hour from here. And this, as you know, that there are a couple of challenges with regards to the government policies and a few other things. And we are hoping to get that up in the next 1 year's time. And what this living lab is, again, very interesting, because this is a green building. It has been designed by HDR Incorporation, New York, one of the top 5 architects in the world. It has used artificial intelligence by screening and scanning close to 1,000 plus traditional buildings in and around West Bengal, and it has mapped the entire flow of wind energy, solar energy over this 1 year period, and it has won these 2 international awards. So our objective is to bring these world-class researchers and stay over here, understand the problems in the communities, get into Sundarbans and other geographies to try and figure it out what kind of innovations would work bottoms up. So that is, I think, one of the major key objectives that we really want to showcase, that how our learnings, our knowledge, and the innovations can be done. We have 2 researchers from IIT Kharagpur. They are arriving. I think they must have arrived, or they are on the way. So we have a device called AP1, which iCure has adopted. This device will be helping, as you know, as I mentioned, that from the Kumirmari Island, if any patient has to come all the way to Gosava, it takes at least a minimum of 6 hours. And in many cases, there are pregnant mothers who needs to be, transported on the boats. So this 6 hours is pretty crucial. So this particular device can give you real-time data about different health statistics like ECG, SpO2, temperature, so that the doctors would be able to track the patient real-time. Like, we will be able to flush information every 3 seconds. These kind of game-changing solutions, which we intend to bring in such vulnerable communities deep within, and as we strongly believe that if we are able to exercise and implement such kind of solutions in some of the most difficult and vulnerable communities, we can definitely make it possible in any other geographies as well. And of course, the other is the Shield AI, with whom we are partnering, through Todd. The objective is that in many cases, because during the deliveries, the mothers need blood or any other things, and it takes several hours for the blood to be delivered. So we are planning to use the UAVs, unmanned air vehicle, which can carry a payload up to 30 kilograms. So you would be able to deliver within 15 minutes of time. So that's what is some of the thought process. Apart from that, our major objective would be definitely, we have partnered with ACT and Dr. Nachiket More. Our objective is that even in the next 50 or 100 years, availability of the doctors with regards to the every population is definitely going to be skewed. We will not be able to fix that. The way we would be able to fix is how we can empower the communities more, how we can, like, our objective is when a health worker is visiting a patient's doorstep, what is the exact protocols or the SOPs that needs to be followed? What kind of procedures that needs to be followed at the first month, second month, and all the way up to the delivery, and even the postpartum deliveries, how that could be done. And we are creating the entire notification module so that the health workers are empowered to take decisions which could be within the purview, and then the doctors can jump in whenever they need to. So these kind of game-changing solutions which we are bringing in, and we are happy that these kind of modules, the notifications has not been done to such extent on the ground, and that is what we would be like to see. What kind of experimentations, what kind of learnings, how much we can really push the boundaries, how much we can really push the envelope for the health workers to adopt such systems, such modules in place, so that they can be with the communities at their hour of need.
Wow. Overwhelming, right? So impressive. This is the meat of the unconference, the unpart of the conference. Okay, I open up to the audience, and starting with Debashish. I have made you wait for a very long time. I'm sure you haven't forgotten your question, right?
Hello. Yeah. So you were speaking about the peripheral, the little islands, the French islands, where you have taken healthcare. I was just wondering who actually funds the healthcare there. Is it the French government? Is it private equity, or how is the healthcare funded in those? Because that eventually becomes a big issue, isn't it? I mean, if we had enormous funds, we could have done a lot. So that's a question to you.
That's what. That's a good question. I think most of it is funded by the French government, indeed. You have some NGOs working there as well, but I would say most of it is funded by the French government. But also one thing is that usually they send young doctors, so not just very, very renowned doctors and so on, but very, very young doctors that are very eager to go to these parts of France. And I think that's one way sometimes is also to bring young people that are very eager to work. But I would say funding is mostly French government, indeed. Yeah. And in terms of funding, I didn't mention something earlier that I think is also quite interesting, is that we have this French development agency like USAID and others. And France basically funds a lot in India, is very focused on Assam, about biodiversity and deforestation, and tries to really, since 2012, reforest the region with other partners, obviously. But it's always the same things with ownership of the people and community there, because what we try to do is to make also to upskill people there, to really work with them closely. And yeah, I was just thinking of that because I didn't mention Assam earlier.
Thank you. That's a very good point, the last point. Yes, I mean, a lot of donors have tracks for funding, and USAID may not be seeing Sundarban or West Bengal as a priority state in India, but vulnerable community is a priority. And so therefore, if we can create a concept note and a case for Sundarban vulnerable community, there is funding available. That's a very good input. Thank you. Any other question? Yes.
So in last 1 year, this is not exactly specific to iCure, but I think there are many other experienced people also working on the similar zone with, from the health lens. So one of the learning we have got from all the stories we have got from the ground is there's a huge scarcity of pathological labs, because once a person, if it is like more than a skin disease or something, you know, at times if a blood test needs to be done, so that takes them around 15 to 20 days to get back the report. So is there anything that can be done for the pathological labs? Because more than often, like, you know, if it is something like, you know, an ECG or something, then they have to travel all the way to Canning minimum to get these basic things done, which we, you know, take for granted in cities. So can something be done about it?
There's a lot of solutions available. Narayana Health's tele ECG is an excellent sort of example available, and they reach out to several you know, underserved sort of areas and do the, you know, through the trained sort of workers, they do the ECG. And online, I mean, there's a doctor specialist sitting there and sort of immediately guiding and advising what's the next step. So yeah, I mean, there's a lot of teleradiology is the other one. Like, you know, there's so much that is available. So the moment we are getting into the digital health area, there's vast opportunities that open up in front of us. I think we should tap into. Yes, please.
But there is, to Pritha's point, the logistics challenge associated with labs. So when you do actually still need to do a lab, I think for sure there's a technology piece of where a lab is not required, but in the circumstance where a lab is required, we'd love to continue that conversation. We've talked about partnerships associated with boatmen and the ferry services to try to get a reliable, consistent path so that you could plan to take the sample, maybe not now, we'll take it right before the boat leaves, and then coordinate the so things to be able to get back. The other thing is certainly the autonomous drones that is on the radar within the autonomous drone space of if there's critical labs, we can schedule pickups, for example, in Kumi Marie, like at a routine level where the drone's going to show up every day or every other day at noon. And so you can plan around, like, and plan when you take the lab samples to put them in there and get them back someplace to get the results. Yeah, and there's an endoscopy, though, is in the technology space where we have brought a company that's that has essentially a pill you can swallow, and then you can remotely do a full endoscopy. It's
Wow.
again remarkable, a whole new
That,
world.
those are the things I think they really require. Yeah.
The answer to your question, Preetha, endoscopy, we can have mobile units, and that is something which we are probably going to invest in the future. You can have even mobile MRIs and CT scan, which could actually travel around Sundarban, and we could easily interpret the findings in the mainland. Endoscopy is also the very similar. I mean, endoscopy is not an emergency, unless of course it's a bleeder which we can't help. We can actually get once in a week an endoscopist to come and travel around this place. And for that, we'll have to sort the logistics out and how the patient is going to be transported. So I think the back end, if we can sort the back end, that is the logistics of patient transport, then we can do a lot. So I think the first thing will be the back end. Other than that, there is a lot of, I mean, digital health when it comes, you'll know, mobile endoscopy, mobile, we can actually do everything mobile, especially.
I think it also has to do with the kind of education, because I heard many of them saying, like, if you have endoscopy, then you might get cancer. So those are the kind of misconceptions are also there, like, you know, within the community.
I think, you know, from a health systems lens, that has to be thought through together with the government, and, you know, and have a very realistic expectation of what the government will do, and, you know, a hub and spoke model then which kind of can provide all of these solutions. There's also an attempt to do something called a patient voices survey, where the representative population voice is going to be then you know, crunched into some insights on what patients are really receiving or not. This is being done by Harvard University for Pan India, but I'm sure it's not covering Sundarbans, and that's where I think this whole pocket gets left out. And ensuring that this gets included because you will need that government support. Right? You won't be able to handle everything on your own. So there'll be primary care and something, but to kind of then, in partnership with the government, define your strategy 1 year, 3 year, 5 years, and then take on what you think you can sustain. Otherwise, there is no end to innovation and experimentation. But do not do it at the expense of communities.
Thank you. I think every good thing has to come to an end. Okay, so that's the ground rule. So I think we talked enough, and you have all the inputs ready with you, like so that we can develop the strategy plan and the KPIs. Keywords like transitioning now, it means public health to planetary health. We are not really talking about public health anymore. I mean, the system that we are now talking about, yes, the existing system, but we need to sort of reinvent that or sort of work on this in the context of planetary health. So what changes or modifications or new elements that we need to sort of bring in is something that we need to think through. One thing that Todd mentioned is very critical, like, how do we visualize this good health that will happen as a result of all this that we are talking about? How is it different from the bad health? How do we communicate that to a common person on the ground that, for us, it's so difficult to visualize after so much of education and working in this area for so long, but like for them, imagine. So here comes Pritha, like think about some innovations. How do we sort of visualize, so what's going to come in a realistic manner, not the dreams, but it's aspirational, but something which is realistic and which will make me motivated to change my behavior or influence the others to change, because I cannot do it alone. The third thing, we can't do it all by ourselves. We need the government. And so therefore, what are the linkages that we can establish with the government? What advocacy, what activism which is required? Let's plan that. We are not talking about PPP. We are talking about private takes the initiative, because the private is the solution in this kind of a context. But we need the government. We need the policies and the rules to support us. And so let's focus on that. With that, thank you very much for your patience. We have taken 1.5 hours. Thank you very much. Thank you, Sumitra. We thought that 1 hour will be too much, but it looks like even 1.5 hours did not suffice enough. We would love to keep hearing more and more. Thank you, everyone. Thank you, Sumitra, Pompey, Sujay, Todd. Thank you so much. And thank you, Emeric and Dr. Sangeeta also for adding your views. And Dr. Rajadhar, of course.